Hello, everyone. My name is Willie Phillips. I'm a Doctor of Athletic Training student at A.T. Still University. On behalf of my advisor, Dr. Nikki Harris, and myself, I will be presenting my applied research project, Retention of Collegiate Athletic Trainers. Over the past few years, we've noticed that many athletic trainers are leaving the collegiate setting early in their careers, well before they reach 10 years in the profession. So let's look at a little bit of background for these reasons for that. Let's look at the educational requirements. Athletic trainers are allied healthcare professionals, and their education is now at the graduate level. And according to the 2023 salary survey conducted by the National Athletic Trainers Association, average salary ranges between 53,000 to 67,000. And if you calculate that to an hourly rate, that falls between $25 to $32 per hour based off a 40-hour work week, which in many cases at the collegiate setting, athletic trainers are working well over 40 hours a week. So that could easily drop down to $20, $25 per hour or less. And according to the salary survey, at the NCAA Division I level, the average salary is 62 or 67,000. At the NCAA Division II level, the average salaries are around 55,000. At the NCAA Division III level, average salaries are at 60,000, and the NAIA level salaries are at 53,000, and at two-year colleges, salaries range at around the 71,000 price point. It is unclear why large disparities exist for athletic trainers across the collegiate settings. Even within the same practice setting, the average salary for an athletic trainer varies depending on many factors, including institution size and budget, athletic division and competitive level, cost of living and geographic area, the model of care, if it's the medical model or athletic model, and experience and credentials of the athletic trainers that are hired. In a study conducted by the Intercollegiate Council for Sports Medicine and the College University Compensation Task Force from the National Athletic Trainers Association, 1,000 collegiate athletic trainers were surveyed, and only 12% reported remaining employed at the collegiate or university setting for more than 10 years. Athletic trainers who left collegiate positions within the past 5 years cited low salary, poor work-life balance, lack of perceived value and employer support, insufficient staffing, burnout as a primary reason for leaving that setting. By understanding what impacts job satisfaction, burnout, and long-term career sustainability, this research hopes to give employers practical insight they can use to boost retention and create more support, lasting employment environments for their athletic trainers. This study employed a qualitative design using a retrospective analysis of a subset of data collected from previously conducted semi-structured interviews. Transcripts were later subject to retrospective analysis by the secondary investigator, myself, DAT student Willie Phillips. Participants were recruited by the primary investigator, Dr. Nikki Harris, via flyers posted electronically to gain interest from athletic trainers to participate in the study. Flyers were shared across various social media platforms, including Instagram, Facebook, and X. Printed flyers were prepared and distributed at the 2025 National Athletic Trainers Association Convention in New Orleans, Louisiana. A convenient sampling approach was further used to email the flyer to athletic trainers in the investigators' professional network. Interviews were guided by semi-structured protocol consisting of open-ended questions designed to elicit detailed narratives regarding athletic trainers' experiences in the collegiate setting. Interviews were conducted by the primary investigator, Dr. Nikki Harris, via Zoom and ranged from 30 to 45 minutes. The secondary investigator, myself, I was able to sit in on one of these interviews. All interviews were audio recorded with participant consent and transcribed verbatim. Identifying information was removed during the review of transcripts to preserve participants' confidentiality. Of the 24 athletic trainers that were recruited to participate, 6 randomly selected transcripts were included in this applied research project. This qualitative research study used a general thematic approach to analyze the descriptive data, or a GTA. The steps of the GTA analysis was transcription, keywords, coding, theme development, conceptualization, selecting, and development of a conceptual model to find patterns that could be interpreted and better understood. The transcripts were then carefully analyzed by myself for common quotes and phrases that could potentially become a pattern for a theme. From the patterns gathered from the data, I began coding short phrases to put together similar statements from the participants' responses. The coded phrases were placed into groups to help identify themes and relationships between those statements. The coded data was placed into tables. In the tables, similar statements were presented. If similar statements were presented 3 or more times, those were grouped together for coding. After an understanding of the coded phrases from the participants, the data was interpreted and created into themes. Of the 6 athletic trainers' transcripts that were selected, 2 were female and 4 were male. The athletic trainers were from 6 different colleges and universities across the United States. 1 worked at the the NCAA Division I level. 3 worked at the NCAA Division III level. 1 worked within the NAIA, and 1 worked at a HBCU. Collectively, the participants had 4.66 plus or minus 3.5 years experience providing care for 119 plus or minus 84 and a half student athletes, ranging 30 to 200 plus student athletes per athletic trainer. From all the coded data that I collected, 6 common themes emerged: pay and compensation, work conditions, professional development or growth, adequate training, location, being seen, heard, or valued. Pay and compensation included hourly wages or benefits or incentives that the athletic trainers received for their time worked. Complaints that the athletic trainers expressed were they did not receive any raises, and if they did, it was less than 1%. They did not receive pay for overtime, and they didn't receive any funding for continuing education, licensure fees, or national dues. The pay overall didn't align with the long hours that they had to work. Also, employers did not match within the employee retirement packages. And these athletic trainers noticed that athletic trainers at nearby high schools received better medical benefits than they did. When looking at statements around pay and compensation, it was quoted 25 times. One statement from participant 15 was, honestly, for me, it's the money. And I know that that's kind of the case for everybody. Work conditions included conditions that may have caused participants to work long hours. For instance, having to provide care for multiple sports teams due to a lack of staff. Athletic trainers complained of the complained that the job was physically demanding on their bodies and the work environment was poor. The facilities and equipment were not up to par compared to other institutions in their conferences or nearby. The athletic trainers felt stress from the lack of support from administration, and these conditions affected the work-life balance and mental health of the athletic trainers. The athletic trainers expressed that they did not want to work every day, and they felt that they should have at least Sundays off. They felt that there was not enough athletic trainers on staff, and athletic trainers were not being updated from coaches and administration in a timely manner. They felt like they were on their own, and there were no updating of the policies and procedures. Statements around work conditions were quoted 46 times. Professional development and growth included aspects of the athletic trainers' employment that lacked in helping athletic trainers advance their careers. This included areas of training for a new hire that the athletic trainers did not receive. This was also a lack of mentorship or educational resources. These athletic trainers did not feel that they were able to gain new skills or knowledge. Athletic trainers lacked help or training that could improve patient care or enhance the services they were able to provide. They also lacked continuing education availability that could help advance their professional career goals. The availability of an athletic trainer to move up or be promoted to a higher position was scarce. There was also limited avenues for advancement in that career. Either staff were there a lot longer than them, upward of 10 years more experience than them, so this caused them to feel that the only way they could move up or be promoted was to leave the institution. There were limited opportunities for promotion, career growth, or senior level job titles. The collegiate or university would not pay for continuing education opportunities for these athletic trainers or bring in professionals to teach them new skills. Areas around professional growth, professional development and growth were quoted 15 times. One statement from participant 15, it'd be nice or it'd be helpful for CUs to be covered by the school to make sure that we're keeping our licensure, keeping our certifications to keep our jobs. Adequate training included onboarding of new employees or on the job training and not receiving enough training or teaching experience for the athletic trainer to feel comfortable or confident in their job roles. Athletic trainers didn't receive proper training of the systems or processes at the university or college. These athletic trainers did not feel that they could perform their job duties correctly. This caused athletic trainers to feel inadequate in their job roles. The athletic trainers wanted to be eased into these roles and mentored, but they didn't receive that. It caused them to feel as if they were thrown into the fire or thrown to the wolves. Athletic trainers felt that they shouldn't be given 4 teams and no proper training on emergency action planning, policies, or procedures. It caused athletic trainers to feel overwhelmed and incompetent in their jobs. Statements around adequate training was quoted 8 times. A statement from participant 13 was, they don't bring people to us to train us and stuff. Location was the geographic location of the institution. They were located in areas that may not be desirable or lacked attractions and activities that appealed to the athletic trainers. This caused a feeling of being in a location that did not offer much for the athletic trainer to do outside of work as part of the reason for them not wanting to stay at these institutions. And even if the job opportunity was a good option, the location of the institution could deter the athletic trainers from wanting to stay there. Statements around location was quoted 3 times. Being seen, heard, or valued was feelings of not being cared for, or that the work performed daily was not being acknowledged. It was a lack of appreciation for the work that athletic trainers performed. Athletic trainers felt that their input was not considered, leading to feelings of exclusion, overwork, and disregard. This feelings of being left out was felt by the athletic trainers when they were not included in meetings or decision making for the department or the health of the student athletes. Athletic trainers felt that the administration catered to what the coaching staff wanted, and there was poor communication between the coaches and administration. These athletic trainers also felt that low pay made them not feel valued or appreciated. The athletic trainers wanted to be recognized for the work that they did. Statements around being seen, heard, or valued was quoted 21 times. Again, the purpose of this qualitative applied research project was to explore collegiate athletic trainers' perspectives on the personal, professional, and organizational factors that influence their retention and potential intent to leave the collegiate setting. The information gathered from the athletic trainers will be written up with suggestions, put together and sent electronically to colleges and universities for review to gain insight on how they can create a better work environment for their athletic trainers. This project can help employers implement change to their organizations that may create an environment that will help with retention. This information can help employers because turnover can be costly, and the information will help save organizations money from constant recruiting, rehiring, and training of new athletic trainers. The pay and compensation influences the perceived job satisfaction, financial stability, and professional value athletic trainers feel. When athletic trainers are paid low salaries and receive limited benefits or incentives, they feel undervalued. If employers can provide fair and competitive pay along with meaningful benefits, it will show that employers appreciate and invest in their athletic trainers' well-being and growth. Improving pay and compensation is essential for retaining skilled athletic trainers and sustaining the quality of care the employee expects of their athletic trainers. Excessive work hours, inadequate facilities, along with the assignment of multiple sports with insufficient support staffing leads to the feeling of poor work conditions. This leads to feeling stressed, fatigued, and burnt out, which decrease the ability to provide quality health care. Creating positive work conditions that include a reasonable workload, proper or adequate staffing, a functional facility, and visible support from administration will help athletic trainers feel supported and respected. The lack of professional development and growth can limit the athletic trainer's sense of career advancement, but it can also decrease a sense of feeling competent in their role. When athletic trainers receive inadequate training, mentorship, educational resources, and limited availability or avenues for professional advancement, they feel undervalued or stagnant. If the employer invest in mentorship programs, continuing education opportunities, and career advancement pathways, it will help the athletic trainers feel engaged, confident, and loyal to the employer. Adequate training directly affects the confidence of athletic trainers. When there is no sufficient on-the-job training or good structured onboarding process, the athletic trainers feel unprepared. If employers can create a comprehensive onboarding and training program, it will help athletic trainers feel supported. It will further help the athletic trainers feel that they are capable of doing their jobs correctly, leading to confidence in their abilities. Location affects the personal satisfaction of athletic trainers. If an athletic trainer is employed in an undesirable area, such as those with limited amenities, professional networks, or social and cultural opportunities, the athletic trainer will feel that there is less of a quality of life and there will be a decrease in job satisfaction. feelings of isolation, and not feeling that they can establish personal roots in the area. Employers can take steps to lessen location challenges by providing incentives, offering bonuses, paid time off, professional development and opportunities, and benefits to family members, housing allowances, cell phone bill reimbursements, or vehicle mileage reimbursements, offering community engagement opportunities, or provided a list of attractions in their driving distances. Being seen, heard, or valued is important in that it's a sense of feeling respected. It is the feeling of belonging to the organization and professional worth. When an athletic trainer feels that their expertise, professional input, or daily contributions are overlooked or undervalued, it lowers the morale, causes decreased motivation, and decrease in job satisfaction, leading to burnout, wanting to express or explore other job opportunities. If employers implement a way to have administration and coaches recognize and respect athletic trainers, it will lead to more job satisfaction. Employers can seek athletic trainers' input, celebrate their achievements, and support them when they voice their concerns. Employers really will have to reassess salaries. Again, looking at the average salary between 53 and 67,000 and the amount of hours that athletic trainers work, as stated earlier, that could easily be 25 to $32 per hour. And with the extended hours, that could easily get down to 20 to $25 per hour or lower. Some athletic trainers may have a hard time providing a good life for themselves or their families with salaries ranging in those levels. I currently reside in Maryland, and in Maryland, excuse me, a single adult with no children must be paid $28 an hour for a living wage. If they have one child, they must earn 45.58 per hour. With two children, they must earn 57.50 per hour, and with three children, they must earn 72.70 per hour. And that's not including a spouse or a spouse who may work. Fixing the disparities in collegiate athletics, it is important for employers to consider the educational preparedness and professional expectations of the role in comparison to that of other allied healthcare professionals. Athletic trainers now must hold a master's degree, which aligns with other allied healthcare professionals like nurses, PTs, or physical therapists, and dietitians. Objectively comparing and evaluating these differences through the education obtained, scope of practice, and compensation structures across allied healthcare professionals could provide valuable insight into the inequities affecting athletic trainers, which could inform employers of more reasonable pay and practices for the collegiate setting. Increasing compensation, employers should consider addressing workload concerns by adjusting job structure and time allocations, including prioritizing coverages of high-risk sports and limiting travel demands. Allowing more time for clinical responsibilities rather than covering low-risk practices may help athletic trainers to balance workload and improve job satisfaction. Employers could lower the workload by offering more staff positions so athletic trainers do not have to work more than one or two sports. Employers can make additions to compensation packages by offering mileage reimbursements for use of personal vehicles, paying for state licensure fees along with national dues. Providing funding so that athletic trainers can take courses, go to conferences, work on continuing education requirements, and they can also provide funding so athletic trainers can purchase clothing for their departments. Employers can include athletic trainers in meetings and decision making regarding the department. Incorporating or recognize athletic trainers at the banquets that they have as well. Limitations of my applied research project was that it was completed retroactively. Interviews were done primarily by the primary investigator, Interview questions were created by the primary investigator, which didn't allow for input to the questions, and there was a small sample size. Future research directions, this study could be conducted at other settings, secondary school settings, inpatient rehab, the industrial setting, performing arts, military, and even doctor's offices. In conclusion, athletic trainers face many issues when working in a collegiate setting. These issues were found to cause athletic trainers to be unhappy at their place of work and in the collegiate setting. 6 major themes developed from participants' interviews of this project, which were pay and compensation, work conditions, professional development or growth, adequate training, location, and being seen, heard, or valued. These themes displayed inadequate pay, poor work conditions, lack of professional growth, insufficient training, and a lack of recognition athletic trainers received. For employers to improve the retention of their collegiate athletic trainers, they must reevaluate how they treat, support, and compensate their athletic trainers. Increasing the salary is essential. Employers can make work environments better for the athletic trainers by enhancing benefits such as paying for National Association dues and state licensure fees, and offering additional incentives such as tuition waivers for immediate family members to enroll in courses at the institution. Also provide a cost of living adjustment to help with inflation. Designated paid time off, a reduced workload by hiring more staff for the department, and by having athletic trainer work one sport per semester. To further enhance benefits, employers can add funding for continuing education to their benefits package. Employers can provide mentorship opportunities and pay for desired certifications that will help enhance the athletic trainer's skills. Employers can make the athletic trainers feel heard and valued by involving them in departmental meetings and listening to their ideas, suggestions, and concerns, and not allow coaches to mistreat the athletic trainers. Lastly, include athletic trainers in award banquets, and you can even offer them an Athletic Trainer of the Year award. Here I have provided a list of references for your review. Thank you for taking the time to go through this presentation. I have listed my email address if you have any questions or want to discuss any of these topics further. Thank you.